Nefrosovet, Healthcare of the Future. What is the definition of a healthy person? The simplest answer to that question is a person who is not ill, that is, a person in the state of full physical, psychological, and social well-being. As reported by the World Health Organization, WHO, the healthcare accounts for 10% of health-influencing factors. This is not as little as it could seem at first, though, because 50% of the factors are distributed to the patient himself. According to the statistics, every 10th person living on the earth manifests signs of the chronic kidney disease. Depending on the severity of the chronic kidney disease, the process of its development has several stages. Due to the above problems, the majority of the patients are addressing a doctor at the 5th stage, the function replacement stage, when the treatment becomes the most expensive. The reorientation of efforts to diagnostics and nephroprotection at earlier stages will allow to slow down the development of the disease and decrease the number and the severity of complications. Our understanding of the healthcare philosophy. Our understanding of the healthcare philosophy is based on the universal algorithm applicable to all methods of treatment. This is the information exchange system, Impact Monitoring Impact, developed by Pyotr Kuzmich Anokhin, Soviet physiologist, developer of the functional systems theory, academician of the Academy of Medical Sciences of the USSR and the Academy of Sciences of the USSR. The treatment is a cyclic process consisting of recurrent stages: collection of data on patient's condition, data analysis, establishment of the diagnosis, and prescription of the treatment program. The final objective is the provision for the patient's health due to the use of high technology and optimized treatment based on the continuous improvement of the quality of treatment and the commitment to minimize the costs. Efficient healthcare. The treatment of patients at Nefrosovet has no formal difference from the structure of the current nephrological healthcare provided by the state. After visiting the polyclinic, a patient, depending on the diagnosis, is forwarded to the outpatient clinic, to the nephrologist, to medical specialists, or to the day and night inpatient clinic for hospitalization. In severe cases, when life-saving procedures are necessary, the patient is forwarded to the intensive care unit. The full-fledged activity of all the structures is supported by the Centers for Laboratory and Instrumental Diagnostics and by the Centers for Operative Surgery and Hemodialysis. Notwithstanding the formal resemblance of the subjects and the objects of the medical activities, the fundamental differences lie in the content. General practice doctor. Even before visiting the polyclinic, a patient can independently perform the screening activities with the help of the TeleMax hardware-software module, which may be located within walking distance from the place of the patient's residence. The TeleMax allows transferring data on the patient's condition to the unified cloud data center, introducing the data into the patient's electronic health record, EHR, and setting up a teleconference with the medical officer on duty. If necessary, the TeleMax makes it possible to resolve the question as to whether it's feasible to visit the polyclinic and to perform further diagnostic activities. At this stage, the TeleMax hardware-software module makes it possible to conduct diagnostic activities which may have influenced on the early detection of the disease, which in its turn improves the quality index of the treatment. As the patient works with Telemax module independently, the costs for the mid-level health professionals may be reduced. The decrease in capital costs is also connected with a reduced need for the premises leased and used. The telemedical way of interaction between a patient and a doctor makes possible the organization of elaborated logistics without losing time in queues. All the data is introduced into the register and processed by the Maximus automated information system for the management of the diagnostic and treatment process. The system allows further monitoring of business processes, patient's condition, procedures, equipment, economic indices, and criteria for the assessment of the quality of treatment and the staff work. During patient's visit to a polyclinic, modern information technology is also used. The patient performs, with the help of a nurse, standard procedures to measure the blood pressure and to assess other health condition indices. A nurse controls measured parameters in the Maximus system. The visit to a primary care doctor or a specialist is arranged with the use of the electronic queue. This provides for the significant simplification of the patients and the information logistics. The time limit of the visit to a doctor is strictly observed and shall not exceed 15 minutes, which in turn provides the increased patient's turnover and shortens the time spent by a patient in the polyclinic. The acceptance of patients is conducted without the participation of mid-level health professionals and requires the minimum number of doctors which deal with the patient's flow. All these results in lower capital costs due to the decreased need for the premises used and lower personnel costs, wage pool. The collection of data is conducted over the whole period of the diagnostic and treatment process, performed by all the relevant departments and centers with the help of the Maximus system. The web access in the online mode makes it possible at any time and at any place to control the patient's condition and to receive and transfer information and reports using references to the patient's electronic health record. The decision support system and the Maximus medical knowledge base are forming the patient's diagnosis and the treatment program using the information on the symptoms and the clinical laboratory data. The final decision on patient's diagnosis and treatment program is up to the doctor. Depending on the results of laboratory and instrumental studies and the diagnosis, the primary care doctor makes a decision on the treatment activities to be performed or on the placement of the patient to the daytime inpatient clinic or 24 hours inpatient clinic. The patient with suspected nephrological disorders is forwarded to the nephrologist who examines the patient and, if the problem is verified, establishes the severity or the stage of the disease and introduces the corresponding data into the register. In other cases, the nephrologist forwards the patients to expert doctor. In order to increase the efficiency of the diagnostic and treatment process, our healthcare centers are widely using telehealthcare services. The nephrologist or the expert doctor do not have to stay at the polyclinic or the medical center, as they may serve patients being at a distance from them with the use of the information provided by the patient's electronic health record. The approach provides for the lowering of the capital costs. The use of the expert support allows elaborating the appropriate treatment program, resolves the problem with the high-qualified professional staff, and provides for the early detection of diseases. The servicing of patient by the expert doctor shortens the time spent by a patient in a polyclinic and has positive influence on the patients and the information logistics. Clinic. As applied to the work of the day inpatient clinic, the treatment program developed by a primary care doctor or the nephrologist with the use of the Maximus system makes it possible to directly lower the costs for materials and medications. The efficient treatment program makes the time of a stay in the daytime inpatient clinic shorter. Hospital. The nephrological inpatient clinic is implementing a complex of measures aimed at the diagnostic and the treatment of patients whose condition requires regular monitoring and correction. In order to improve the quality of the treatment and to lower the costs, we have equipped our inpatient clinics with the newest technological and information instruments, optimizing the work of the whole staff. The use of modern diagnostic methods makes it possible for a doctor to find the shortest way to reach the goal, that is, to make the maximally precise diagnosis within the shortest time and with minimum costs. After establishing the correct diagnosis, the clear treatment program is developed. The engagement of experts and the use of telehealth care methods increase the efficiency of the treatment activities. The activities make it possible to reduce the duration of the most expensive part of the treatment, that is, the time spent by the patient at the inpatient clinic, which directly correlates with the reduction of usage of the expendables and the medications. Due to the lack of local qualified nephrological staff, we have developed the system of remote control and management of treatment and all supporting processes. The consultations are held directly at the site of the patient's bed. The expert of the remote nephrological center uses the video camera integrated into the bedside monitor to ask the patient about their health, to manage the remote examination, and to give to the attending physician recommendations as to the choosing of the adequate therapeutic approach. Intensive care. In intensive care units, work with patients is carried out by organ systems. This is why it was necessary to develop a wide variety of equipment intended for the support and the monitoring of the different body systems, cardiac monitors, lung ventilators, and other types of equipment. When we speak about reanimation, we speak about life-saving and not only about the treatment quality improvements. From the point of view of the treatment costs, the intensive care is the most expensive kind of treatment. The reanimation requires complex diagnostic activities and the engagement of highly qualified mid-level health professionals. Besides working with patients' electronic health record, the module of the Maximus system located in the reanimation department collects the data received from the different equipment, shows it on the monitors in different combinations, allows for its analyzing, and automatically forms recommendations for reanimation specialists on the basis of the standards of treatment of the relevant systemic syndromes. Laboratory. The making of a correct diagnosis is impossible without obtaining results of laboratory studies in timely manner. The regional network of Nefrosovet laboratories satisfies the demand for high-quality laboratory studies in the region. The automation of the laboratory samples registration, the preliminary processing of the study results and making of the preliminary diagnosis by the doctor, laboratory assistant, the automated transfer of laboratory study results to the place of patient's treatment through high-speed digital channels, all the above helps the attending doctor to develop an adequate treatment program. Hemodialysis. The hemodialysis procedure performed at our nephrological centers is aimed at a high-quality provision of the service along with a reasonable minimization of costs due to the use of the automated information system for the management of the diagnostic and treatment process. A patient is supplied with a personal electronic card used to keep track of all registration and treatment activities. The patient performs self-facilitated automated check of weight and blood pressure, which makes it possible for the staff of the medical center to be engaged in other kinds of qualified work. Many routine operations upon the introduction of the data into the system are automated by the use of barcode scanners. In the Maximus system, a patient is a fully competent user along with a doctor, a nurse, and engineer. Using the bedside monitor, the patient can review the data on the treatment, monitor the relevant parameters, record medications administration, receive information on the prescribed diet, and simply spend hours of leisure watching TV programs, films, and informative content on the disease. A patient can also communicate with the attending doctor using the telecommunication module. Analytical instruments integrated into the Maximus system help the doctor to get maximally close to the understanding of the reason of the patient's disease and to develop the complex of necessary treatment activities. The doctor is also monitoring the manifestations and the course of the chronic kidney disease complications, anemia, mineral bone disorders, hypertension, and chronic cardiac failure. The nurse working in the dialysis room loads the prescription for the hemodialysis procedure either directly at the side of the patient's bed or at another terminal or mobile device. The accounting of used medications and expendables is performed with the use of the system of barcodes. The interface of the nurse's AWS provides for the possibility to control temperature conditions and air humidity in the departments. Surgery. The surgery rooms of the nephrological centers are fitted with modern equipment. The engagement of highly trained expert surgeons make it possible to conduct complex operations on the installations of hemodialysis access system and the surgical treatment of hyperparathyroidism. Telecommunication technologies are being widely used. In particular, the video picture from the camera located at the illuminator makes it possible for the staff participating in the operation, remote experts, and students to follow the surgeon's work.